Okay, in a medical emergency, which tool do you think is better? A super complex chemical key that's designed to pick the locks of the brain, or just a simple change in physics to help the lungs? Today, we're looking at two completely different solutions for two life-threatening problems. And you know what? The answer might not be what you expect.
So let's get right to it. How do you treat two emergencies that feel like they're from different planets? One is a storm inside the mind, a battle of delicate brain chemistry. The other is a physical traffic jam in the lungs, a problem of pure mechanics. As you're about to see, the solutions are just as different as the crises themselves.
All right, let's meet our two main players. In one corner, you've got haloperidol, a powerful antipsychotic drug. And in the other corner, Heliox, a surprisingly simple mix of gases. Yeah, the same stuff you might find in a party balloon. And right away, the difference is just huge. Haloperidol is a complex antipsychotic, a chemical designed to navigate these super intricate pathways of the human brain. But Heliox? It's just a simple mix of helium and oxygen. It doesn't even try to change your body's chemistry. It works entirely on the level of physics.
Okay, this is where it gets really, really cool. The how. One is like a targeted biochemical mission, while the other is just a clever lesson in airflow and physics. Let's break down exactly what that means. So, haloperidol's job is to act like a chemical gatekeeper inside the brain. It specifically finds and blocks certain dopamine receptors, which helps calm things down during a severe psychotic episode. Think of it like a very specific key made for a very complex neurological lock. Now, Heliox is totally different. It doesn't touch your body's chemistry at all. Its superpower is its low density. It's about a third as dense as the air we're breathing right now. See, when your airways get really tight, regular air gets all chaotic and turbulent, making it almost impossible to breathe. But the much lighter Heliox just glides right through in a smooth, easy flow. We call that laminar flow. It's just a beautiful, elegant physical fix for a physical problem. And in an emergency, speed is absolutely everything. And just look at the difference here. Helio gives you immediate relief. The patient breathes it in, and breathing gets easier instantly. Haloperidol, on the other hand, has to travel all the way through the bloodstream to get to the brain, and that takes time. Even with an IV, you're talking up to 20 minutes. That is a massive difference when every single second counts. So, with all these differences, when do you actually use them? Well, it all comes down to using the right tool for the right job. I mean, you wouldn't use a hammer to turn a screw, right? And you definitely don't want to get these two mixed up. So here are their very specific jobs. Haloperidol is brought in for behavioral emergencies, to calm a patient who's extremely agitated or going through a psychotic break. It's all about managing a crisis in the nervous system. Heliox is for airway emergencies. Think about a child with severe croup or someone having a terrible asthma attack where they physically cannot get air past a blockage. Of course, no medical treatment comes without some risk. And this is where the comparison gets even more dramatic when we look at that benefit versus risk equation for each of these. Wow, I mean, the contrast here is just night and day. Because haloperidol messes with brain chemistry, it comes with a whole list of potential side effects. These can be anything from really distressing involuntary muscle spasms, called dystonias, to a really powerful, uncomfortable restlessness. And most seriously, it can cause changes in the heart's rhythm, which means you have to be monitored really carefully. And Heliox, well, because it's just a gas that helps you breathe, it has an incredibly clean safety profile. So those risks mean you have to be extra careful. For instance, that heart rhythm risk means anyone getting haloperidol through an IV needs to be on a heart monitor the whole time. For pregnant patients, it can be used, but you've got to use the absolute lowest dose that works. Now with Heliox, the math is different. There isn't a ton of data on it in pregnancy, but we know for a fact that a mother not getting enough oxygen is a direct and serious threat to the fetus, which makes it a critical tool in that situation. Okay, so let's wrap this all up. We've looked at two very, very different tools designed for two very, very different kinds of emergencies. This table really says it all, doesn't it? Brain versus lungs, biochemical versus physical, slow and complex versus immediate and simple. One is this finely tuned chemical intervention, a product of some really complex pharmacology. The other is just elegant physics. And that contrast leaves us with a pretty fascinating question to chew on. We usually think of medical progress as this steady march towards more complex drugs for more specific targets. But the story of Heliox shows us that sometimes the most brilliant solution isn't biochemical at all. Sometimes it's just a simple, elegant change to the physics of the problem itself. It really makes you wonder,
Where will the next big medical breakthroughs come from? Will they be from complex chemistry or from simple physics? Thanks for joining me on this explainer.